Welcome to Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society, produced by HCP Live. Hosted by Skin of Color Society leaders, Skin of Color Savvy delves into the latest research, clinical insights, culturally competent care practices, and other news important to skin of color dermatology, featuring highly recognized experts in the field.
I'm Dr. Brittany Oliver, a board-certified dermatologist practicing in Kansas City, Missouri as an assistant professor of dermatology at the University of Missouri, Kansas City. I have a special interest in hair loss and pigmentary disorders and am a proud member of the Skin of Color Society, actively engaged in the Media Relations Committee. Through Skin of Color Savvy, we're here to provide dermatologists and healthcare providers with expert perspectives on treating patients with skin of color, advancing care, celebrating diversity, and making a meaningful impact together. So let's dive in.
Sounds good. So, Dr. Oliver, let's begin with a look at the power of mentorship in dermatology. From your experience, what are your thoughts about the impact of mentors on a trainee's journey?
Certainly. So mentorship is an incredibly powerful tool and truly has the ability to shape a trainee's career. Dermatology is a very small field, and it's no secret that the guidance of a mentor in the field is one of the most valuable facets of that very daunting and competitive residency application process. But it's not just about finding someone to vouch for you. Ideally, it's something deeper where there's a mutual respect that goes both ways. A mentor should challenge you intellectually, and if you meet those challenges and demonstrate your ambition and worth ethic, a trust will naturally develop, and in turn, a genuine desire on the part of the mentor to actually see you succeed. And if that genuine desire is there, it can feel like there's no limit to what you can accomplish. That support also serves to boost your confidence. I felt that way in my mentorship experiences, and can actually help you believe that you are capable of doing what you are setting out to do. Mentors can help you achieve tangible goals, whether that be via networking connections, support of an application like that residency application I mentioned already, publication of a research manuscript, and all of these certainly impact the career trajectory of a trainee. However, mentors can also just open your eyes to career paths and specialty niches that you may not otherwise have stumbled upon, perhaps igniting a new passion or a new direction for your career. And I do think that although mentorship needs change throughout someone's career, I think professional development is continuous, and no matter the stage, whether you're a student, a resident, or early, middle, or even late career attending dermatologists, there are valuable things to be learned from those who are more seasoned than you.
Absolutely. Well, please tell us then about the mentorship opportunities that SOCS offers to physicians in training.
Absolutely. So mentorship is one of the 4 pillars of SOCS, the others being research, education, and advocacy. We greatly value mentorship as a leadership development tool to foster a diverse workforce at all levels, developing and empowering future leaders of the field. First, the SOCS Mentorship Program is a comprehensive program that connects young physicians and medical students with an approved skin of color expert from SOCS. Then there's the SOCS Observership Grant, which provides support to dermatology residents, medical students in the 2nd through 4th year, as well as junior faculty to enable study with a SOCS mentor identified by the applicant. And most recently, we now offer a unique initiative in conjunction with the NMA dermatology section known as the Diversity in Clinical Research Mentorship Program. This groundbreaking mentorship program helps develop the skills of dermatology investigators of tomorrow, offers support to the underrepresented minority investigators, or URMs, providing an experience that mirrors conducting industry-sponsored research and helps participants gain the knowledge needed to run a successful and high-quality research program. Interest in these amazing programs is very high, and we're very interested in securing more mentors to meet this demand. So listeners can visit the SOCS website to learn more.
Excellent. Okay, and speaking of mentors and role models, it's February, and we're in the middle of Black History Month. We'd love to hear from you about those who have inspired you along your journey as a dermatologist. So can you share a few pearls from those who have made a difference to you through their mentorship?
I certainly consider myself lucky to have had a number of fantastic mentors along my journey as a dermatologist. It started with someone recognizing my potential as a medical student, not quite sure which career I wanted to pursue. And that was Dr. Adam Friedman at the George Washington University, where I completed medical school. And then later on, while completing my residency at the University of Pennsylvania, I had the opportunity to work with and learn from Dr. Susan Taylor, the founder of the Skin of Color Society, who quite literally wrote the book on skin of color. But talk about, learning beyond the textbook, spending time in her clinic, observing her counsel patients and diagnose and manage skin and hair conditions helped me to grasp both nuance in dermatologic disease that might have taken years to appreciate, and also the art of engaging with and interacting with patients. Aside from that, Dr. Taylor's support is the reason I served a full term on the American Academy of Dermatology's Diversity Committee as a resident. And since then, I have served on other communities and task forces, both within the AAD and SOCS. So it really served as kind of a springboard for my involvement in advocacy, education, and leadership. She really paved the way in many regards in the field of skin of color and continues to be an incredible role model for myself, and I know for many, many other young residents, students, and dermatologists. In my current position as a junior faculty member, I hope to emulate her commitment to mentorship and lift up those coming up in the next generation of dermatologists. That's one of the many reasons I transitioned from private practice, where I was previously practicing, into an academic role. Hopefully, serving as that mentor that I was very lucky to have in my training.
Excellent. Okay. Well, February is also American Heart Month and, of course, Valentine's Day as well. So it's a time to raise awareness about matters of the heart, including cardiovascular disease.
This is definitely a very, very important issue for dermatologists and cardiologists alike, as there is a significant relationship between dermatologic conditions that can indicate underlying heart disease and cardiovascular conditions that can cause skin changes. As we know, heart disease disproportionately impacts communities of color.
Yeah, absolutely. And this is a big question, but what are your thoughts about how these disparities can be further addressed in actionable ways? And what would you like your colleagues in dermatology and other specialties to keep in mind?
That is a big question. I do think that continuing to work towards rectifying the lack of racial and ethnic diversity in medicine is important. Building and fostering early pipelines, starting in high school, it sounds very early, but I don't think it is, can lead to enhanced representation of communities of color and thereby improve access and quality of care. A lot of this is about exposure. If you see someone who looks like you in a role that you maybe never envisioned yourself, that starts to open doors within young, moldable minds. And we do know, for example, that Black physicians are more likely to care for underserved populations. So I do think that is one important approach. Social advocacy, volunteer work is another approach that you could take, as many contributors to health inequities are systemic and structural and may lie outside of the walls of your clinic. So I would encourage my colleagues in dermatology and other specialties to maybe take a step back and look at your community. Open your eyes and really see what's going on. Who needs help, and what power do you have, not only as a physician, but also as just simply a highly regarded member of society with means and resources? How can you give back with your time and expertise? So it could be anything from local volunteer work to engaging with your medical society, whether that be AAD, SOCS, AMA, or any number of specialty organizations. Get on a task force, get on a committee, pay attention to what's happening in your local government. Whatever you do, just don't be complacent and assume that someone else is going to do the work.
Excellent. Excellent. Well, that's all for today. Thank you for joining us for this episode of Skin of Color Savvy. We hope you found today's episode informative and inspiring. If you're interested in learning more about the Skin of Color Society and its incredible work, visit skinofcolorsociety.org. Don't forget to subscribe to HCP Live's newsletters and follow us on social media to stay up to date on the latest in dermatology and more. And we'll be back soon with another episode, so be sure to subscribe to Skin of Color Savvy on your favorite podcast platform. Until next time, take care, and thank you for listening.
Thank you for having me.